That's a very important question. By population determinants, I mean those major influences that affect cancer outcome. And I believe that the two most important determinants are culture and behavior. Culture, another word for it might be the norms, the traditions by which people have been brought up. And so those norms determine behaviors, and behaviors determine cancer outcomes. We've got to look at it from 2 points of view. One is the provider, and secondly, the patient. From all the research, we know that it is the provider who's the most important influence on the care and quality of the patient, so that if the provider took the initiative to aggressively seek the appropriate and care for the individual, more than likely the patient's going to follow through. Now from the patient's perspective, the culture and behavior. Now, when the patient hears about what needs to be done, then it goes through the filter of culture and societal influences, and so I think that's the extent to which it governs. Now, I can give you some good examples of how both of those influences have worked. Take, for instance, the norm of non-smoking. Non-smoking now is the norm, and all the societal influences, including the environment and including the legislation and restrictions, all favor never smoking or non-smoking. And so this is an example where an environmental influence can be the, shall we say, the culture that determines the behavior, which is not to smoke, or at least to hopefully never start. Another example might be, let's say, seatbelts. Seatbelt usage is another kind of a norm, and that has, of course, saved lives. So those are some examples, I believe, of the population determinants. Now, I focus on tobacco because tobacco is the single most important preventable cause of death, and so that I use as a case of what has worked, and the tremendous declines in lung cancer rates is proof that it has worked.